Thank you so much for joining us. It's great to have you.
I'm glad to be here today, and I feel like I have some good news on a couple of fronts.
Yeah.
Which, you know, a lot of people don't feel like there's good news in the health insurance and Medicare world,
But there is.
I have some good stuff today.
Big news for Medicaid recipients, a big win.
Yes, so August the 1st, which is Thursday, the final decision will be made that it's looking like provisionally licensed therapists in the mental health field will be able to begin seeing Medicaid patients. And so what that means is a huge amount of access that they haven't had before because they could not see provisionally licensed therapists. And so it helps those people that, like my son, that have finished their master's degree, but they're still finishing out the hours that they have to do, not the education piece, but the hours, and now they can begin seeing these people. So for the huge amount of mental health issues that we have in our area and people that need help, it's a win, and it's a win for all of the counseling places for a revenue stream to be able to do what they love to help people.
It is definitely a great win.
Yeah, so August 1st.
How can we get more information on that if you're a Medicaid recipient or maybe you feel like, just like you mentioned, a student, you know, you're not at work, you're still in grad school, you may qualify.
Absolutely. They just need to call the number on their card, on their Medicaid card, and it will tell them like who's going to be in network, and that might take a while since it is going to be like an August 1st thing that they're bringing it down. It may take a while to get that network in there, but places they couldn't previously get in, they could probably call now and they'll have provisionally licensed people that are taking new patients. So it's going to be a big help.
On another level of mental health, Alzheimer's, there's now a support group for Alzheimer's with Medicare. Yeah,
well, it's a new focus thing that the CMS has rolled out. It's called the GUIDE model, and don't know if you know these stats, but in 2023, 6.7 million people had some form of dementia, and they're projecting 14 million by 2060. And so this GUIDE program is designed to help the unpaid caregivers that are helping people with dementia to introduce services and education to keep people in the home for longer and plugged into their community for longer. But they need more education, more services, and there is now a 24/7 access phone number that people can call to get support and help while they're caring for those people, or the dementia people themselves if they're
early
able to call, or and they just need a place to call. They can, if they're cognizant, they can call this number, or their caretakers can. So there's just so much of it that they're trying to provide more and more resources. The program started July 1st, and it's going to run for 8 years to measure the metrics.
Well, Jennifer, we're out of time. I know we have a lot more to talk about, but we can talk about it next time.
Absolutely.
It's always great. I always learn a lot from you when you come on the show. Great to have you. We'll be right back.